We are increasingly placing importance on the use of ultrasound in the consultation room. This is critical. We are with a patient who 4 years ago came in with anterior pain and had scalec rotator cuff tendinopathy. We performed the rotational drive aspiration technique with a compaquet plasma, which we had at IDAS, a rather chronic tendinopathy, and we applied our technique, for which we even received an award at a congress, and the patient has been doing perfectly for 4 years, right? No issues. Today she is here for a similar but different issue in the same shoulder, but the pain is now not at the front but on the side. We have seen that there is no adhesive capsulitis because the patient moves the arch, moves it well, this shoulder is not stuck, and she experiences very clear pain in the subacromial space. So we believe it could be a tendinopathy. It could be a recurring one. It could be a new condition. We're going to do an ultrasound now. When we do the ultrasound, we indeed see on the anterior aspect the subscapular, the PLB, and now in the area where we did the therapy, here we see some small leftovers, but the tendon is not so thick, and this looks effectively good. The footprint, so it's not a hit, but still has a lot of pain, a little more on the lateral aspect of the shoulder. We're going to take the ultrasound machine on the side, and what a surprise it is. When we come across now, notice this diffuse chunk of calcification. This is a type 3 Ghana with even a process of synovitis there in the bursa and thickening. Calcification is starting to form just not in the tendon space, but almost in the bursal space. One long axis and one short axis. Look also at how this entire area looks. This area is foggy. It's not a typical area, the hard and pure lateral side, but the ultrasound has helped us understand what's happening. And now on the go, another advantage, we're going to do a pulsing washing technique. We're going to use a little bit of serum, the local anesthetic, and a little bit of cortisone. In this case, as it is very acute, it is not necessary to use growth factors. Let's go. The patient is in a scream of pain, in tears. This is the typical face of acute calcium tendinopathy. People, you ask him, "Why aren't you talking to me?" Well, don't worry, we're going to improve it. Let's go.